Hi, welcome to Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Jess Wilson. Jess is the founder of Believe Recovery Counseling in Oklahoma and also the president of OKAAP, which is the Oklahoma Association of Addiction Professionals. Jess is a licensed alcohol and drug counselor and who is passionate about helping others to overcome their addictions and their mental health issues. Jess is a professional member of the National Association of Alcoholism and Drug Abuse Counselors, the Oklahoma Drug and Alcohol Professional Counseling Association, the Association for Size, Diversity and Health, and Oklahoma Eating Disorder Association. Welcome to Addiction Recovery Place, Jess. It's great to have you with us today.
Yes, I'm excited to be here.
No, very much appreciated with your time. I really do appreciate it. So we're just going to jump straight into the questions, Jess. Can you tell us about your journey in the addiction treatment field and how you started your private practice?
Yeah, absolutely. So I started in the addiction field because of my own personal journey. That's what got me into schooling and all of that. When I first got into the field, I started working with adolescents. It was something I didn't think I was going to love doing, but I did. I had a professor that was like, "No, I think you'll be good at this." And I was like, "No, I want nothing to do with adolescents." And I just loved it. It was a lot of hard work. And from there, I worked with DHS clients, drug court clients, methadone, Suboxone, adults, adolescents, everything in between. Just a lot of different areas in the addiction field. I was working at a community mental health center when I started my 5-year plan for private practice, and things just kind of, when you make a plan, don't go according to plan. And so it happened a lot sooner than I wanted. And it allowed me to start seeing eating disorder clients, which I was excited for.
Mm-hmm. So how soon did it take you to start your practice? Because you said you had a 5-year plan. How quickly did you start it?
It went from 5 years to 2 months.
That's incredible. Wow.
Yeah.
Well, congratulations on taking the leap. That's impressive that you had a 5-year plan and you did it in 2 months. So no, kudos to you. So with your private practice in Oklahoma, what are some of the therapies that you offer people experiencing addictions and mental health trauma?
Yeah. Seeking safety is one of like the basic core modalities that is often used in Oklahoma for the co-occurring of trauma and addiction. It starts with the basics of learning skills because it's harder to do the hard work of trauma if you don't have the skills to cope with the symptoms that are coming up. And the great thing about seeking safety is it brings in both components of addiction and trauma, but it works for both singular as well. Added in, I also use cognitive processing therapy and written exposure therapy for my trauma clients. But a lot of that is starting with the basis of what are the skills that we can do to help you.
Mm-hmm. Wonderful. You also specialize in helping those with disordered eating or eating disorders under the principle of health at every size. Can you tell us about this and how you help people with disordered eating patterns with these principles, Jess?
Yes. So my background is in addiction work, and we work through like process addiction. In the addiction world, we classify eating disorders under process addictions, and then eating disorders doesn't look at it as a addiction. And I kind of bring a wealth of knowledge of how to both of those informations kind of come together. The health at every size principle is that no matter what your size, no matter if you are in a straight size body or in a larger body, you have the right to medical care regardless, and that we're focusing on treating you as the person and not your size, and that we really focus on how can I help you with your symptoms, and that your size and all isn't a part of that. And so it's about how can we help you advocate with medical professionals outside of the mental health realm? How do you navigate the medical fat bias, weight stigma that is out there, and kind of just overcoming that? And so with a lot of the eating disorders, regardless, there is a level of bias and automatic stigma that if you're in a larger body, then you automatically have binge eating disorder. And as you are at a straighter size body or a underweight, is that you're automatically anorexic. And so it's about really focusing on, we got to look at the criterias that they're being, and a lot of the things like BMI isn't a thing. Like, it is rooted in racism and weight stigma and bias, and that it's not an accurate measurement of anyone's health. And so that's a lot of what Health at Every Size is about, is that we're not restricted to our size. We can be healthy in larger bodies, and we can be unhealthy, or have medical issues and straight size bodies as well. So it's this concept of health isn't determined by your size.
Yep, absolutely. Absolutely. That's a word that stigma is a word that comes up time and time again in these podcasts. And it could be so damaging to someone who wants to enter a healthier life, or to look at kind of their issues or their addictions. And stigma is just, it's very frustrating that we're still in this day and age where a stigma can stop someone entering treatment. It really is. We mentioned earlier NADAC. So how long have you been a NADAC member and in your role as president of the Oklahoma branch?
Yes, I have been a NADAC member since 2017. I had a supervisor that was like, hey, this is a great organization, join. And at that time, Oklahoma didn't have affiliate, and she had me be a part of the entry-level affiliate meetings to get an affiliate started. And we were getting ready to get an affiliate started, and then like COVID and all that happened, so things kind of just fizzled out a bit. And then in 2023, we started seeing a lot of the emails about an Oklahoma affiliate starting back up again. And so I was like, yes, I want to be a part of that. And I've been a part of that since the beginning. We became an official affiliate in 2023. And so we're just babies out here in the NADAC world as far as an Oklahoma affiliate. So we're just working on trying to get the information out there that OKAAP exists, and that we're excited to have all of our members join and be a part of that.
Mm-hmm. So how many members do you have in Oklahoma, and how are you promoting to get new members to join? And how often do you meet as well, Jess?
Yes. So we have about roughly between 70 to 80 members. It kind of fluctuates from month to month. Our main focus right now is getting the information out about NADAC in Oklahoma, because not a lot of people know about NADAC, or if they do, it's a small niche of people. And so our membership drive includes just like telling people about NADAC. So we're going to start visiting universities and talking to the students about NADAC. We have been doing a lunch and learn series at the beginning of the year, kind of like that countdown to your CEUs for your licensure. Our licensure renews in June. I don't know about yours, but ours renews every June. And so from about December to June, we're in that countdown crunch to get your CEUs. And so one of the things that OKAAP offers is free CEUs to our members. They can attend those trainings for free, which is really great, as well as all the trainings that NADAC provides. And so that's pretty much been our membership drive so far. We're small, but we're mighty. And so we're just trying to get that information out as best as we can.
Yeah. So since you've been a member of NADAC, Jess, what are some of the benefits that you've seen with being a member, with your own career growth and your own personal growth within obviously your business, your service as well, your private practice?
By far, the education piece is my favorite. I'm a nerd. I love education. I love all the things that I can get my hands on to learn about this field and about our clients. To me, client care, the best client care that we can provide is through education. So if we're not educating ourselves, we're not providing our best client care that we could. And so I'm all about like that education. So I love that. The other piece that I think is so important that I love so much is the connection with other members like yourself, like meeting other people from other states. Because sometimes it can feel very siloed, even in your own state, like we're just by ourselves. And when I joined NADAC, it was like, oh, wow, there's way more out there than just what's in Oklahoma. And I love that, like being able to see and explore what other states are doing.
Mm-hmm. Absolutely, yeah. It's a fantastic organisation, and it's I've met some amazing people since joining as well. So it's been really good for me as well. We're going to talk about your state at the moment, Jess, because when we had the pre-podcast call, we spoke obviously about fentanyl and the opioid crisis, which is obviously the number one issue around the country, sadly. So how is Oklahoma coping and managing with this crisis?
You know, one of the things that I love that Oklahoma has been kind of progressive in is that our Department of Mental Health and Substance Abuse, they have been getting out fentanyl testing trips out into the community. So a lot of our community mental health centers or hub centers have those strips to provide to clients out in the community, which is wonderful. Because that's life-saving. Prevention is always life-saving. And if we can get that out there, that's wonderful. And then added in Narcan. I think the ability to go to any community health center and get free Narcan is again, those life-saving efforts that is absolutely needed. And they went a bit further this year. They have vending machines that have Narcan in them. And I think that was just phenomenal. Like it's normalizing it. It's not putting it as shame or that stigma of you have to hide what you're going through, and that anybody can walk through the door. So it doesn't have to be the addictive person. Like it could be the family member. It could be their neighbor, your random cousin. It could be anybody that can get access to the Narcan. And that is just wonderful.
So I think this is my 31st podcast. I think you're probably the second person to tell me that Narcan is available for free in your state. That's incredible. I mean, that really is. And it's quite surprising hearing that certain states have different rules around this and the finances. And it's just great to hear that Oklahoma seems to be addressing this as it should be. This should be a free thing. This should be accessible to everyone, because clearly there's a massive crisis going on around the country. You also told me when we first met that people are using marijuana also overdosing on fentanyl, and this is obviously very concerning, something I hear from other professionals. Would you say that drug use is now much a higher risk than it was, say, 5-10 years ago?
I think drug use today and 2024 and probably beyond is probably more dangerous than any other time in our history. Because fentanyl, it takes the smallest amount and it can be dropped in any drug and not a single person know. People are repackaging pills and things. And so there's so much more danger to using today than there was, because like with marijuana, no one suspects to overdose on marijuana, but it just takes the tiniest bit of fentanyl to be placed in a bag of marijuana and you wouldn't know. And that's dangerous to me.
It doesn't make any sense to me, and I don't quite understand why this is happening in this day and age. And someone who's just buying a bit of cannabis can die from that. I mean, that 10 years ago would never have even been talked about. Mm-hmm. It is very frightening how it seems to be every drug is now potential risk of fentanyl. You also mentioned in Oklahoma the medical marijuana policy and how this is affecting the state. So what are the main issues that you've noticed? And can you tell our audience your concerns about how this is being managed within your state?
Yes. So currently medical marijuana in Oklahoma is regulated as far as like there's certain medical necessities that are able to obtain a medical marijuana license. And with that, oftentimes what we'll see, I've had clients who've told me, yeah, I got pulled over for marijuana and the cop just told me, go get a medical marijuana license and this won't happen again. And that doesn't really help the problem that we're dealing with, especially when they're sitting in front of me as a client, because there's a lot of dangers in that. And the medical marijuana is not the same as street marijuana, and it's not the same marijuana that was, in the 70s and 60s and 80s even. The medical marijuana is just a different strain and a different level of potency. And there's a lot of vets are seeing an uptick in animal overdoses and or animal exposures. We just don't know enough about what is out there from the medical marijuana and how it's impacting. There are some studies, but there's not a lot. We have a lot of our clients that will want to use it for depression and anxiety. And we do know that there is a study that shows that is not beneficial for depression and anxiety symptoms, and I can exacerbate it. Then you have individuals who are using edibles, and we know that edibles can induce psychosis episodes. And if somebody already has like an undiagnosed psychosis in their family history, that can be very dangerous. It's just very dangerous to know kind of what's going on. And so knowing your family history is really important, but also kind of looking at what it is that's out there, talking to professionals, just not medical professionals, things like that. There are number of ways people can get a medical marijuana card without seeing like a primary care doctor. Like they can go to like a .com doctor. Sometimes these doctors are like OBGYNs. So there's not really a straightforward oversight or regulation to the program. And so I know that there are some medical necessities for individuals with different medical issues, but for the addiction world, it's very hard. I think medical marijuana makes it very difficult when we're helping people with addictions, which kind of comes into, okay, we take a harm reduction approach then, and I'm just going to educate you on the dangers and talk to you about the benefits of sobriety. And because it's never my job to get them sober, it is my job to educate and give them the information and work through the issues. So I think that's another thing that kind of really helps me as a professional is like, while I know the dangers and I know the struggles of medical marijuana, it's body autonomy with the client to figure out how they want to approach that.
Absolutely. Absolutely. So how's treatment for addictions for young people in Oklahoma dealt with, and what are the resources for this age group?
I wish we had more resources in Oklahoma for adolescents. I absolutely do. I see a lot of intensive outpatient programs popping up for adults, and I worry about our adolescents because we wouldn't so many adult treatment centers if we had more care for our adolescents. And I think I can count on the number of like residential programs on one hand in the state for adolescents. Very few. And we've had a couple that closed up in the state and throughout the years. And so, like I said, I started my addiction field working with adolescents. And so my heart starts there with them. I know that that's our biggest prevention is if we can work with our adolescents, we can make sure that they are getting the education that as they walk into adulthood, maybe that isn't the path that they choose, because we all know that the path of recovery is hard. And so if we can, even if it's experimentation with drugs and it hasn't quite gotten to a full-blown addiction, that's where our prevention starts. And so I'd love to see more adolescent programs. There are some agencies that do wonderful work. In the county that I live in, Canadian County, Oklahoma, there is a Canadian County Children's Justice Center, and they have a residential program there. It's free for all of their Canadian residents. So, and teenager in the Canadian area can go there for free for services. You have inpatient and outpatient services. as well as there's treatment for adults at that location as well. They do a lot of DHS work. There is a children's recovery center down in Norman that works with co-occurring, which is fantastic. There is White House Ranch, I believe that's Woodward, Oklahoma, that deals with women's adolescent girl treatment. And then there is Jack Brown Adolescent Center that is for our tribal members.
I see.
Those are the ones that are off that I know of.
Yeah.
But I'm sure that there's more because I haven't been in the adolescent field for a little bit. So,
But you've seen a reduction in services available for young people since you've been in this field, yeah?
Yes.
Is that due to funding, would you say?
Lack of funding is always going to be an issue for any of our services. I also think that a lack of providers that have the special training for adolescents, and I know NADAC is currently trying to work on a certification program for adolescent therapists. And they recently had like a beta stage. I don't know if it's still going on, but I know that they were really looking for providers for that purpose, because I know that there is research trends that show that there's not enough providers at the bottom and the top of our age groups for addiction work. So we don't have enough for our adolescents and our children, our young children into adolescent phase, and then our elderly population. So I think there's not a lot of knowledge and education to prepare us to work with adolescents.
That's great to hear that you were saying that NADAC are looking into doing this as well, because there's a clear need.
Yes, absolutely.
It'd be interesting to follow that.
Yes. I think the big thing is that what's needed with adolescent care is the family component. It's needed throughout, even working with adults. And so not a lot of treatment providers have that family component, but it's really important in that adolescent stage. And sometimes that's really hard to wrangle the family into sessions. So.
Well, thank you for explaining that to me, Jess. That's really interesting. Come to the last few questions now, Jess. I ask all of my guests this question because I get some really interesting answers. But can you tell me your opinion of harm reduction and how it plays such a pivotal role within recovery?
I am a huge fan of reduction. We have to meet the client where they are, and that is harm reduction at its greatest, at its finest. I use harm reduction both with addiction individuals as well as my eating disorder individuals, because not everybody comes into therapy and is like, yes, I'm ready. Let's get on this, right? And so harm reduction says, okay, well, what if you were to do this? What would happen to your life if you did this, right? And we look at what are you willing to work on? And let's start there. And I think harm reduction is another aspect of it saves lives. And why wouldn't we do it? The whole purpose that we're in here is to help save lives and help people get on their recovery path. So for me, if you're using heroin, meth, and marijuana, I'm not going to start with the marijuana. Let's get you off the heroin and meth. Let's start there. Eating disorders, diet culture is so prevalent and it's so hard. And so it's like calling out the diet culture. It's okay. I understand calorie counting has been a thing you've done for the majority of your life. Well, what if we just didn't do it one day? What if we just didn't do it 2 days? And kind of working with that and letting some of that go until, the greatest part of harm reduction for me is coming into a session and a client saying, guess what? I didn't do it today. I didn't use at all. I didn't use any of it. Or I didn't calorie count in the last week. And that's like, what? That's phenomenal, And I think that's the most rewarding part for me with harm reduction is we give the client the autonomy to make those choices. And sometimes they make it quicker than what we're expecting in their treatment plan. So it's just wonderful.
Yep, that's a great answer. Thank you for that, Jess. What future plans do you have for your private practice?
So I am taking new trainings next year, and I'm the nerd. I like my education, so I'm super excited for those trainings. That's just going to make me a better clinician and a better client care for my private clients. I don't have really any huge plans. I'm just kind of settling out and just finding my way. I do want to work more in passive income opportunities, such as like notebooks and journals. I have a lot of great techniques that I use for clients, and I share it with my coworkers. I'd love to be able to put that together to be able to share with clients. So that's a big goal on my list, is to accomplish some workbook and worksheets and stuff for clients down the road.
That sounds awesome. That really does. And what you've achieved, as I mentioned earlier, that you had a 5-year plan and you jumped straight in there. And what you're doing now is just incredible. It really is. And it's very impressive hearing your story. Do you have a message for anyone listening to this podcast who is going through addiction or is going through some kind of trauma, Jess?
The best thing I can say is you're not alone. There is hope. And that's what we as providers are here for, is to provide you that hope. Because I know it's like to walk in those doors or to reach out, it's scary. And the fact that you even just do that is a huge step. And we'll carry the hope until you see that stuff is working for you. You're starting to get aspects of your life back and just start to pull in that hope yourself. And so you're not alone, and we're here to help.
Wonderful. Last question. Can you tell our listeners how to best to contact you and to find your service online, and also how to reach out to you to become a member of OKAAP?
Yes. So for my private practice, you can find me at believeok.com. All my information is located. You can find my email and phone number on my website. And as far as OKAAP, we'd love to have you. Please join.
Okay.
For OKAAP, you can find us at OKAAPNAADAC@gmail.com.
Marvelous. Well, Jess, it's been a real pleasure to talk to you and to find out about your amazing work and your career, which you've really springboarded into beautifully. And obviously with your work through NAADAC, who's just an amazing organization. It's been a real privilege to talk to you today. Thank you very much for your time. I really appreciate it.
Thank you. I appreciate you having me on.
Thank you, Jess.